45-year-old female presents with a persistent cough, weight loss, and night sweats. A chest X-ray shows an upper lobe cavitary lesion. What are the key differential diagnoses for this presentation, and what diagnostic tests would you recommend to further evaluate the suspected conditions? Answer: the clinical presentation of a persistent cough, weight loss, night sweats, and an upper lobe cavitary lesion raises suspicion for several conditions, particularly tuberculosis (TB), common in certain populations and characterized by cavitary lesions; lung cancer, particularly squamous cell carcinoma, which can also present as a cavitary lesion; fungal infections, such as histoplasmosis or coccidioidomycosis; sarcoidosis, although typically not cavitary, it can cause granulomatous lung disease. To differentiate among these conditions, the following diagnostic tests should be considered. Sputum analysis for acid-fast bacilli AF, smearing culture to diagnose TB. Bronchoscopy allows for visualization and possible biopsy of lesions and can also be used to obtain sputum samples. CT scan of the chest offers more detailed imaging of the lung lesions and can help characterize them further. Fungal serologies to evaluate for potential fungal infections. The ecoclinical setting, how can distinguishing between an obstructive and a restrictive pattern in pulmonary function tests (PFTS) aid in diagnosing underlying lung pathology? Provide specific values that might indicate each pattern. Answer: pulmonary function tests (PFTS) are crucial for differentiating between obstructive and restrictive lung disease. Obstructive lung disease, characterized by a decreased FeV ratio 70% in restrictive conditions, e.g. pulmonary fibrosis; interstitial lung disease, both FeV and FVC are reduced, but the ratio may remain normal or be increased due to a greater proportional decrease in FVC. Recognizing these patterns helps direct further investigations and management strategies, such as imaging or referral to specialists. A 60-year-old man presents with new-onset dyspnea and chest discomfort. A CT scan shows mediastinal widening and a large right pleural effusion. Discuss the possible etiologies of these findings and the role of imaging in guiding further management. Answer: the combination of mediastinal widening and a large right pleural effusion suggests several potential etiologies. Malignancy, lymphoma, or lung cancer can present with mediastinal mass and associated pleural effusion due to metastases or direct invasion. Infectious processes, tuberculosis or lymphoma can lead to both mediastinal lymphadenopathy and pleural effusion. Autoimmune diseases, conditions like sarcoidosis may present with mediastinal lymphadenopathy and effusion. Imaging plays a crucial role in the management of these conditions. Follow-up imaging, e.g. repeat CT or ultrasound, to assess the characteristics of the pleural effusion, e.g. transudative versus exudative, using criteria such as Light's criteria, thoracentesis, diagnostic and therapeutic procedure that can provide fluid for cytological analysis and culture, assisting in the diagnosis of infections or malignancies. A patient presents with jaundice and elevated liver enzymes. Which laboratory tests would you prioritize to distinguish between hepatocellular injury and cholestasis, and what specific values or patterns would indicate each process? Answer: in a patient with jaundice and elevated liver enzymes, the following laboratory tests are essential. Liver function tests specifically evaluate the levels of alanine aminotransferase ALT and aspartate aminotransferase AST versus alkaline phosphatase ALP, and bilirubin levels. Hepatocellular injury, characterized by significantly elevated ALT and AST levels, typically 100 or often in greater proportion to ALP. Cholestasis, indicated by elevated ALP levels, which are often more pronounced than ALT elevation. Total bilirubin may also be elevated with an increased direct conjugated fraction. Understanding these patterns helps narrow down the underlying pathology, guiding further diagnostic evaluation, e.g. imaging or liver biopsy. Mr. Thompson, a 50-year-old man with a history of smoking and chronic bronchitis, presents with increased shortness of breath and a recent productive cough with purulent sputum. Given his symptoms and history, what initial management steps should be taken? Consider the role of antibiotics and potential exacerbating factors in your answer. Answer: in Mr. Thompson's case, the initial management steps should focus on addressing the acute exacerbation of chronic obstructive pulmonary disease caused in potential infectious processes. Key steps include assessment of severity, using the Modified Medical Research Council (MRC) dyspnea scale and assessing oxygen saturation levels to determine the need for supplemental oxygen. Bronchodilators, administer short-acting bronchodilators, e.g. albuterol, for immediate relief of symptoms. Antibiotics, Given the productive cough with purulent sputum and the patient's history of smoking and chronic bronchitis, initiating antibiotics e.g. amoxicillin clavulanate or a macrolide is indicated to cover potential bacterial exacerbation. Corticosteroids. Systemic corticosteroids e.g. prednisone may also be beneficial in reducing inflammation and improving lung function during an exacerbation. Education on exacerbating factors. Discussing smoking cessation and avoiding irritants e.g. environmental pollutants is crucial for long-term management. Discuss how the concept of prevalence and incidence can impact public health interventions, particularly in the management of communicable diseases. Provide an example to illustrate your answer. Answer. Prevalence refers to the total number of cases of a disease in a population at a given time, while incidence refers to the number of new cases that develop in a specific period. Understanding these concepts is vital for public health interventions. Prevalence. High prevalence indicates a significant burden of disease which may necessitate comprehensive healthcare services and chronic disease management strategies. For instance, a high prevalence of diabetes may lead to community screening programs and educational initiatives to promote lifestyle changes. Incidence. High incidence indicates an increasing trend of disease occurrence, suggesting the need for immediate interventions such as vaccination campaigns or outbreak control measures. For example, during an outbreak of measles, identifying the incidence can help determine the effectiveness of vaccination efforts and inform public health responses. A 30-year-old female presents with sudden onset of severe abdominal pain, fever, and vomiting. What differential diagnoses should be considered based on her presentation, and which clinical findings would be most relevant to confirm the diagnosis? Answer. The acute presentation of severe abdominal pain, fever, and vomiting in a young female warrants consideration of several differential diagnoses, including acute appendicitis, typical presence with right lower quadrant pain, fever, and nausea vomiting. Ectopic pregnancy, consider in reproductive age females, especially with associated pelvic pain and irregular bleeding. Pancreatitis can present with severe epigastric pain, possibly radiating to the back, along with elevated serum lipase or amylase. Cholecystitis, characterized by right upper quadrant pain, fever, and possibly jaundice, often confirmed with imaging studies e.g. ultrasound. Relevant clinical findings for confirmation may include abdominal tenderness and rebound tenderness, particularly in appendicitis or cholecystitis. Pelvic exam to evaluate for possible ectopic pregnancy. Laboratory tests such as elevated white blood cell count, liver function tests, and imaging studies to assess for gallstones or other abnormalities. Describe the role of MRI in the evaluation of neurological disorders. What specific conditions benefit from MRI, and how does it enhance the diagnostic process compared to other imaging modalities? Answer. MRI plays a crucial role in the evaluation of neurological disorders due to its superior soft tissue contrast and ability to provide detailed images of the brain and spinal cord. Specific conditions that benefit from MRI include multiple sclerosis. MRI can reveal characteristic demyelinating lesions in the brain and spinal cord. Tumors. MRI is particularly useful for identifying brain tumors, their size, location, and impact on surrounding structures. Stroke. Diffusion-weighted imaging (DWI) can detect early ischemic changes, improving management outcomes. Spinal cord compression. MRI can evaluate herniated discs, tumors, or other compressive lesions affecting the spinal cord. MRI enhances the diagnostic process by providing high-resolution images without radiation exposure, allowing for better characterization of lesions and aiding in treatment planning. A patient presents with fatigue, pallor, and a low hemoglobin level on a complete blood count (CBC). Discuss the steps in the diagnostic workup to determine the underlying cause of anemia, including specific lab tests and their interpretive significance. Answer. In evaluating anemia, particularly in a patient with fatigue and pallor, a systematic approach is essential. CBC with reticulocyte count. To differentiate between types of anemia, a low reticulocyte count suggests inadequate production of red blood cells, whereas a high count indicates peripheral destruction or loss. Peripheral blood smear can provide valuable information on the morphology of red blood cells, helping to identify microcytic e.g. iron deficiency, macrocytic e.g. vitamin B or folate deficiency, or normocytic anemias. Iron studies, including serum iron ferritin, total iron binding capacity (TIC), and transferrin saturation to evaluate for iron deficiency anemia. Vitamin B and folate levels. To rule out megaloblastic anemia, bone marrow biopsy may be warranted if aplastic anemia or malignancy is suspected. Understanding these tests and their results is critical for determining the etiology of anemia and guiding treatment decisions. MS Rodriguez, a 25-year-old woman, presents with episodes of palpitations, sweating, and anxiety. Her symptoms are often accompanied by a sensation of impending doom. What initial diagnostic approach would you recommend to evaluate her symptoms, considering both physiological and psychological factors? Answer: in MS Rodriguez's case, the presentation suggests the possibility of panic attacks or a physiological condition, e.g., pheochromocytoma. An initial diagnostic approach should include comprehensive history to assess the frequency, duration, and context of the episodes, as well as any potential triggers or stressors. Physical examination, including vital signs to check for tachycardia or hypertension, laboratory tests, basic metabolic panel, complete blood count, and thyroid function tests to rule out hypothyroidism, 24-hour urine catecholamines and metamphrenes to evaluate for pheochromocytoma if suspected based on clinical findings, psychological assessment, utilizing standardized questionnaires, e.g., the Generalized Anxiety Disorder 7-item scale to evaluate for anxiety disorders. This comprehensive approach is essential for differentiating between underlying physiological conditions and anxiety-related disorders, ultimately guiding appropriate management strategies. What are the primary osteopathic manipulative treatment (OMT) techniques used for managing headaches, and what is the rationale behind their use? Answer: key OMT techniques for managing headaches include soft tissue techniques, muscle energy, and counter-strain. Soft tissue techniques. These involve stretching and applying pressure to the muscles and fascia to alleviate tension and improve blood flow, addressing musculoskeletal components that may contribute to headache pain. Muscle energy techniques. These require the patient to actively engage in resistance against the physician's force, enhancing muscle relaxation and restoring normal range of motion, which may reduce headache frequency and intensity. Counter-strain. This technique involves positioning the patient in a way that minimizes discomfort in tender points, helping to alleviate muscle spasm and pain associated with tension headaches. The rationale behind using these techniques is grounded in the osteopathic philosophy of addressing the body's self-regulation mechanisms and enhancing its innate healing capacity. Discuss the significance of TOT in the diagnosis of somatic dysfunction. How does it assist in the clinical evaluation of a patient? Answer: TOT stands for tenderness, asymmetry, restriction of motion, and tissue texture change. This mnemonic is critical in the osteopathic structural exam (OS) as it provides a systematic framework for identifying somatic dysfunction. Tenderness. Assessing for localized pain helps identify areas of dysfunction. Asymmetry. Observing asymmetrical posture or movement indicates dysfunction. Restriction of motion. Testing the range of motion reveals limitations that may suggest somatic dysfunction. Tissue texture change. Evaluating changes in the skin, fascia, and muscle texture can signal underlying issues. By using TART, clinicians can comprehensively evaluate a patient's physical status, ensuring a thorough understanding of the somatic dysfunction and informing appropriate treatment strategies. Scenario: Mr. Thompson, a 55-year-old male, presents with chronic neck pain that radiates to his right shoulder and is accompanied by headaches. He has a sedentary job and reports significant stress related to work. During the osteopathic structural exam, you note tenderness in the cervical region, asymmetry in shoulder height, and restricted range of motion in the cervical spine. Question: what specific OMT techniques would you consider appropriate for Mr. Thompson's condition, and how would you justify their selection? Answer: for Mr. Thompson, the following OMT techniques would be appropriate. Muscle energy techniques. Targeting the cervical muscles can help alleviate muscle tension and improve range of motion. The rationale is that by actively engaging the patient in resistance, you can facilitate muscle relaxation and restore function. Soft tissue techniques. Applying gentle stretching and kneading to the cervical region and upper back may help relieve tension, increase blood flow, and reduce pain. Counter-strain techniques. Identifying tender points in the cervical region and positioning Mr. Thompson in a way that reduces discomfort can promote relaxation of hypertonic muscles, contributing to his pain. These techniques are justified as they not only target the structural issues identified in the OSA, but also address the potential impact of stress and lifestyle factors on his condition, fostering a holistic approach to treatment. What are some common contraindications for osteopathic manipulative treatment, and why is it crucial to recognize them before performing OMT? Answer: common contraindications for OMT include fractures. Performing manipulative techniques on fractured bones can exacerbate injury or delay healing. Acute infections. OMT can spread infection or worsen the inflammatory process. Severe osteoporosis. Manipulative techniques could lead to fractures in patients with compromised bone density. Malignancies. Tumors may be sensitive to pressure or manipulation, potentially leading to adverse effects. Recognizing these contraindications is critical to ensure patient safety, prevent harm, and maintain the integrity of osteopathic practice. It also emphasizes the importance of thorough patient assessment before initiating treatment. Discuss the role of OMT in the management of chronic pain conditions. How does it integrate with conventional medical practices? Answer: OMT plays a complementary role in managing chronic pain by addressing musculoskeletal components that contribute to pain syndromes. Integrating OMT into conventional medical practices involves collaboration with other healthcare providers. Osteopathic physicians often work alongside primary care providers, physical therapists, and pain specialists to create a comprehensive treatment plan. Holistic approach. OMT considers the biopsychosocial model of health, addressing not only the physical but also psychological and social factors affecting the patient. Evidence-based practice, utilizing research to support the efficacy of OMT in pain management, enhances its acceptance in conventional medicine and promotes a multidisciplinary approach. This integration emphasizes the importance of treating chronic pain holistically, improving patient outcomes and enhancing overall well-being. Explain the significance of preventive care in osteopathic medicine. How can osteopathic principles guide health promotion efforts in a clinical setting? Answer: preventive care is fundamental in osteopathic medicine, emphasizing the importance of health maintenance and disease prevention. Its significance lies in patient education. Osteopathic physicians educate patients about lifestyle modifications, nutrition, and exercise, empowering them to take an active role in their health. Holistic assessment. By considering the whole person, osteopaths can identify risk factors and implement preventive strategies tailored to individual needs. Early intervention. Utilizing OMT and other preventive measures can help detect and manage health issues before they progress, reducing morbidity and healthcare costs. Osteopathic principles guide health promotion efforts by fostering a proactive approach to patient care that emphasizes wellness, self-regulation, and the body's inherent capacity for healing. In the context of a patient-centered approach, how do osteopathic principles guide the clinical decision-making process? Answer: osteopathic principles, particularly the focus on patient-centered care, significantly influence clinical decision-making by building therapeutic relationships. Engaging patients in their care fosters trust and collaboration, leading to better treatment adherence. Individualized treatment plans. Osteopaths consider the patient's unique context, including physical, emotional, and social factors, when developing treatment strategies. Encouraging shared decision-making. Involving patients in decisions about their care promotes autonomy and enhances their commitment to treatment plans. These principles underscore the importance of understanding the patient as a whole and tailoring care to meet individual needs and preferences, ultimately leading to improved health outcomes. What are the underlying principles that guide the application of high-velocity, low-amplitude HVA techniques in OMT, and what are the clinical indications for their use? Answer: the principles guiding HVLA techniques in OMT include neurophysiological mechanisms. HVLA works on the premise that a quick, controlled thrust can reset muscle spindle activity and facilitate proprioceptive feedback, leading to improved joint function. Biomechanical principles. HVLA aims to restore normal range of motion and alignment in the affected joint, addressing somatic dysfunction. Indications for use. Common clinical indications for HVLA include joint restrictions, acute and chronic musculoskeletal pain, and certain postural dysfunctions. The application of HVLA should always consider the individual patient's condition, ensuring that it aligns with osteopathic principles of safety and efficacy. Explain the concept of a body unity in osteopathic medicine. How does this principle influence the approach to diagnosing and treating a patient with somatic dysfunction? Answer: the concept of a body unity is a cornerstone of osteopathic philosophy, emphasizing that the body functions as an integrated whole rather than as a collection of separate systems. This holistic view posits that all physiological, anatomical, and psychological components of the body are interconnected. Therefore, an issue in one area can affect other regions and systems, leading to a cascade of dysfunctions. Key aspects of body unity: interconnected systems. The body's systems, musculoskeletal, cardiovascular, nervous, etc., interact continuously. For example, chronic pain in one area may lead to compensatory changes in posture or movement, which can then result in dysfunction in other parts of the body. Self-regulation and healing. Osteopathic philosophy holds that the body has an inherent capacity for self-regulation and healing. This means that optimal functioning requires a harmonious balance among its systems. When one system is impaired, it can disrupt the body's ability to maintain homeostasis. Influence on diagnosis. When diagnosing somatic dysfunction, osteopathic physicians employ a comprehensive approach that considers not only the presenting symptoms, but also the patient's history, lifestyle, emotional state, and environmental factors. For instance, if a patient presents with lower back pain, the osteopath would assess not just the lumbar region, but also evaluate the thoracic spine, pelvis, and even stresses that might contribute to muscle tension. Holistic treatment approach. Understanding body unity allows osteopathic physicians to devise treatment plans that address the underlying issues contributing to dysfunction rather than merely alleviating symptoms. Treatment may include osteopathic manipulative treatment on techniques like muscle energy, soft tissue techniques, or HVLA to restore normal function and balance, lifestyle modifications, recommendations for exercise, diet, and stress management to promote overall health, patient education, helping patients understand the interconnectedness of their health conditions and empowering them to engage in their healing process. Describe the mechanism of action of soft tissue techniques in OMT. How do these techniques support the overall osteopathic treatment plan for a patient with musculoskeletal pain? Answer. Soft tissue techniques in osteopathic manipulative treatment (OMT) are manual therapy methods that involve the assessment and treatment of the soft tissues of the body, including muscles, fascia, and connective tissues. These techniques aim to enhance circulation, improve mobility, and reduce pain and tension in the affected areas. Mechanisms of action. Muscle relaxation. Soft tissue techniques, such as stretching and kneading, help to relax hypertonic, tight muscles. By applying sustained pressure or rhythmic motions, the practitioner can influence the muscle spindle fibers, leading to a reduction in muscle tone and a decrease in pain perception. Improved circulation. Manipulating the soft tissues enhances blood flow to the area, which facilitates the delivery of oxygen and nutrients necessary for tissue repair and healing. Facial release. The fascia, a fibrous connective tissue that surrounds muscles and organs, can develop restrictions that impede normal movement and function. Soft tissue techniques can effectively release facial restrictions, restoring proper alignment and mobility. Neurophysiological effects. The tactile stimulation provided by soft tissue techniques can activate proprioceptors, sensors in muscles and joints, and mechanoreceptors, sensors for touch and pressure, sending signals to the central nervous system. Integration into treatment plans. Soft tissue techniques play a critical role in the comprehensive osteopathic treatment plan, particularly for patients presenting with musculoskeletal pain. Their integration involves assessment. The physician first evaluates the affected area for tenderness, texture changes, and range of motion, determining which soft tissue techniques would be most beneficial. Combination with other OMT techniques. Soft tissue techniques are often used in conjunction with other OMT methods, such as muscle energy and HVLA. Patient education. Educating patients about the benefits of soft tissue techniques empowers them to engage in their care. Patients may be encouraged to perform stretches and self-massage techniques at home to maintain mobility and prevent the recurrence of symptoms. A public health official is reviewing the effectiveness of various preventive medicine strategies in reducing the incidence of chronic diseases. Discuss the role of primary, secondary, and tertiary prevention in chronic disease management, providing examples of each type. Additionally, explain how these strategies can be integrated into a comprehensive public health program. Answer. Preventive medicine is categorized into 3 levels. Primary prevention. This aims to prevent the onset of disease. Strategies include health education, vaccinations, and lifestyle modifications. For example, community-wide smoking cessation programs reduce the incidence of lung cancer. Secondary prevention. This focuses on early detection and intervention to halt disease progression. Screening programs, such as mammograms for breast cancer or blood pressure screenings for hypertension, exemplify secondary prevention. Tertiary prevention. This level aims to manage and improve the quality of life for individuals already diagnosed with chronic diseases. Examples include rehabilitation programs for stroke patients and chronic disease management programs that help patients control their diabetes. Integrating these strategies into a public health program enhances effectiveness. For instance, a program could implement primary prevention through health education, offer secondary prevention through regular screenings, and provide tertiary prevention through patient support services. Critically evaluate the impact of vaccinations on public health, focusing on herd immunity. What are the implications for communities with lower vaccination rates? Include a discussion of the balance between individual autonomy and public health benefits. Answer: vaccinations significantly reduce the incidence of infectious diseases and contribute to herd immunity, where a sufficient proportion of the population is immunized to protect those who cannot be vaccinated, e.g. immunocompromised individuals. Herd immunity is essential for preventing outbreaks if, for instance, a vaccination rate of about 95% is needed for measles to achieve herd immunity. Communities with lower vaccination rates risk outbreaks of vaccine-preventable diseases, leading to increased morbidity and mortality. An example is the resurgence of measles in areas with declining vaccination rates. Balancing individual autonomy with public health benefits is complex. While individuals have the right to make healthcare decisions, public health laws, e.g., mandatory vaccination laws in certain states, aim to protect community health. The ethical challenge lies in ensuring that individuals understand the importance of vaccinations while respecting personal beliefs. Explain the rationale behind age and risk-based screening guidelines for colorectal cancer. What factors should be considered when determining an individual screening schedule, and how do these guidelines reflect an understanding of disease epidemiology? Answer: screening guidelines for colorectal cancer (ERC) are informed by epidemiological data showing that the incidence of CRC increases with age and is higher in individuals with specific risk factors such as a family history of the disease or genetic syndromes like Lynch syndrome. U.S. Preventive Services Task Force (USPS) recommends screening for average-risk individuals starting at age 45, recognizing that early detection improves outcomes. Factors to consider in determining an individual's screening schedule include: age. Younger individuals are generally screened later than those over 50. Family history. A positive family history may necessitate earlier screening, e.g. starting at age 40 or 10 years before the age at which a relative was diagnosed. Personal health history. Individuals with a history of inflammatory bowel disease may require more frequent screenings. These guidelines reflect a comprehensive understanding of disease epidemiology, promoting early detection in populations at higher risk while considering the benefits and harms of screening. MS. Anderson, a 52-year-old woman, presents for a routine checkup. She has a family history of breast cancer. Her mother was diagnosed at age 47 and has been experiencing mild weight gain and increased stress due to her job. What risk assessment strategies should her physician employ to address her individual health profile, and what preventive measures can be recommended? Answer: given MS, Anderson's age, family history of breast cancer, and lifestyle factors, her physician should employ the following risk assessment strategies. Family history evaluation. Utilize family history to assess her genetic risk for breast cancer. A referral for genetic counseling and possible BRCA testing may be appropriate. Lifestyle assessment. Evaluate her diet, physical activity, and stress levels. Assessing her weight gain may indicate the need for dietary modifications and an exercise plan. Screening recommendations. Following the American Cancer Society guidelines, she should undergo a mammogram annually starting at age 45, and clinical breast examinations should be included in her routine checkups. Preventive measures may include implementing a nutrition and exercise program tailored to her needs, offering stress management resources such as counseling or mindfulness techniques. These strategies aim to mitigate her risk for breast cancer and address lifestyle-related health concerns. Analyze how socioeconomic status influences health disparities in access to preventive care services. Discuss the implications of these disparities on population health outcomes and the role of policy in addressing these issues. Answer: socioeconomic status significantly influences access to preventive care services. Individuals with lower SES often experience barriers such as lack of health insurance, limited transportation options, and reduced access to health education. This results in lower utilization of preventive services like vaccinations and screenings. Health disparities due to SES contribute to poorer population health outcomes, including higher rates of chronic diseases and reduced life expectancy. For instance, individuals in lower SES groups may have higher rates of conditions such as diabetes and hypertension due to limited access to preventive care and healthy lifestyle resources. Policies addressing these disparities can include expanding health insurance coverage, e.g., through Medicaid, enhancing transportation services to healthcare facilities, and implementing community health programs that provide education and resources to underserved populations. Effective policy interventions are crucial to promote equitable access to preventive care and improve overall population health. Discuss the importance of patient education in smoking cessation programs. What strategies should healthcare providers employ to effectively counsel patients, and how do motivational interviewing techniques enhance these efforts? Answer: Patient education is critical in smoking cessation programs as it empowers individuals with knowledge about the risks of smoking and the benefits of quitting. Effective counseling strategies include personalized education, tailor information to individual needs, emphasizing the health benefits of quitting and addressing personal motivations. Goal setting, collaborate with patients to establish achievable quit dates and strategies, enhancing commitment. Resource provision, provide access to resources such as support groups, quit lines, and pharmacotherapy options, e.g., nicotine replacement therapy. Motivational interviewing techniques enhance smoking cessation efforts by fostering an empathetic and supportive environment. This approach helps patients explore their ambivalence about quitting, strengthens their motivation, and facilitates behavior change. By employing reflective listening and open-ended questions, healthcare providers can guide patients toward recognizing the benefits of cessation, ultimately improving quit rates. Evaluate the role of epidemiology in understanding and managing disease outbreaks. What are the key steps in an outbreak investigation, and how does this process inform public health interventions? Answer: Epidemiology plays a crucial role in identifying, managing, and preventing disease outbreaks through systematic investigation. The key steps in an outbreak investigation include confirming the outbreak, establishing that an outbreak exists by comparing current data with expected incidence rates, describing the outbreak, characterizing the outbreak by person, place, and time to identify trends and potential sources, developing a hypothesis, formulating hypotheses regarding the source and mode of transmission based on epidemiological data, testing the hypothesis, conducting analytical studies, e.g., case control studies to evaluate the hypotheses, implementing control measures, applying public health interventions based on findings such as vaccination campaigns, public awareness efforts, or quarantine measures, communicating findings, reporting the results to stakeholders and the public to inform future prevention strategies. Analyze the impact of occupational and environmental exposures on public health. How should healthcare providers approach risk assessment for patients exposed to hazardous substances, and what guidelines should inform their practice? Answer: Occupational and environmental exposures can significantly impact public health, leading to chronic diseases, acute illnesses, and long-term health complications. Healthcare providers should approach risk assessment through the following steps. Exposure history. Obtain a detailed occupational and environmental history, including the duration, frequency, and types of hazardous substances encountered. Assessment of symptoms. Evaluate any symptoms that may be associated with exposure, such as respiratory issues from inhaling toxins or skin conditions from contact with chemicals. Utilizing guidelines. Apply established guidelines from organizations such as the Occupational Safety and Health Administration (OSHA) and the National Institute for Occupational Safety and Health (NIOSH) to inform practice regarding permissible exposure limits and health surveillance recommendations. Referral and collaboration. Refer patients to occupational health specialists for comprehensive evaluations and potential interventions, fostering collaboration between healthcare providers and public health officials. Describe the concept of risk assessment in the context of chronic disease prevention. What factors should be considered in a comprehensive risk assessment framework, and how can this information guide clinical decision-making? Answer: Risk assessment in chronic disease prevention involves evaluating an individual's likelihood of developing a disease based on various risk factors. A comprehensive risk assessment framework should consider demographic factors. Age, gender, and ethnicity can influence disease risk. Medical history. Pre-existing conditions, family history, and previous health issues are critical for understanding risk. Lifestyle factors, diet, physical activity, smoking, and alcohol consumption should be evaluated as they significantly impact chronic disease risk. Environmental factors, exposure to pollutants, occupational hazards, and socioeconomic status must be assessed to understand external influences on health. This information guides clinical decision-making by enabling healthcare providers to tailor prevention strategies. For example, an individual with multiple risk factors may benefit from a more aggressive intervention approach, such as early screening or lifestyle modification programs. Examine the relationship between chronic stress and its impact on physical health. How can healthcare providers implement effective stress management strategies, and what role does patient education play in these interventions? Answer: chronic stress is linked to various physical health issues, including cardiovascular disease, obesity, and diabetes. The physiological mechanisms involve increased cortisol levels, which can lead to inflammation and compromised immune function. Healthcare providers can implement effective stress management strategies such as mindfulness-based interventions. Techniques like meditation and yoga can help patients develop coping skills and reduce stress. Cognitive behavioral therapy (CBT). This approach can assist patients in identifying and changing negative thought patterns that contribute to stress. Support groups. Facilitating access to support groups fosters social connections and shared experiences, providing emotional support. Patient education plays a crucial role in these interventions by equipping individuals with knowledge about stress and its health impacts. Educating patients about recognizing stressors, the importance of self-care, and effective coping strategies empowers them to take an active role in their health management.